So if you just want to tell us what the situation is, I mean, if we go back to right at the beginning when you first heard about the changes.
Yeah. So Slaithwaite Health Centre practice has a PMS contract, personal medical services, as a result of really the effective failure of the surgery in the early 2000s and subsequently. So the services kind of came to us to an end here, and the commissioners conducted effectively a public consultation and analysed the needs of the local people and specified a service, and two of my partners at the time won the contract in a competitive tender to provide the service. I joined them about a year later, and we've made a big success of the place. Our list size has gone up by, it's a kind of rags to riches story really. We've gone up by sort of 30%. We've got nearly 5,000 patients here now, thank goodness. And we pretty much, we meet all and exceed all expectations. I think on the NHS Choices website we're sort of classed as amongst the best, or whatever the phrase is. And for me personally, I kind of thought I'd see out my days in the sun here in the Colne Valley. I like working here. My family used to live very near here, and I've done other stuff in the health service previously, involved in setting up the GP out of hours service here years ago with others. I didn't do all the work, certainly don't deserve all the credit, but it was an exciting time when we made a big difference for local people. But I thought that was the end really for getting involved in leadership and change, and that it was time to just focus on the clinical work and just carry on as long as I could really here. I'm quite happy working here. But then out of left field we got a letter in 2014 basically signalling that our budget was going to be decimated, that we were going to be losing nearly 44% of the budget. And it was pretty clear straight away that was not survivable. And we've pretty much opposed it ever since. I think, we have continually flagged up to NHS England that this is not doable. We've also continually flagged up that somebody ought to tell our patients about it. Indeed, that they have statutory responsibility to tell our patients about it.
So has there been any kind of consultation from?
No. And I'm not aware of. I'd be interested with your coverage. Would be interested to know, has there been any consultation anywhere else? Because a number of practices have come to us because of the publicity that's been generated around the country, and so far we have not found a practice or a community where there has been any form of public involvement, let alone certainly no communication. And that's the real story here, is that one of somebody in the community here has felt so strongly about this that they took legal advice and they're taking legal proceedings, and we'll see where that goes. And what I'm beginning to hear from other parts of the country is that other patients are feeling that strongly that they're talking to lawyers. So I don't know, I'm a GP, not a lawyer, but I think in summary, this to us was wrong, inherently wrong from day one. We tried to engage with NHS England, but they've ignored all our correspondence. We had our first response to a letter just a few weeks ago. The statements that they issued to the press in response to publicity about our plight, and in response to the actions of our patient support group, who are generating headlines of their own, the statements that are released make no sense. They're factually incorrect. We were described as a community effectively as a leafy shire with no particular deprivation or extreme health needs. But I mean, you've just driven here from Leeds. Is this a leafy shire? And it isn't for me as a GP every day when I visit social housing, I visit vulnerable elderly people, I visit troubled families, lonely folk with mental health disorders, drug addiction, alcoholism, safeguarding issues, disproportionate amount of child safeguarding issues. Yet we're described as in effect as a leafy shire. I mean, they didn't use that phrase, but the implication is. So I think we were right to stand up, and I'm quite glad that other practices are standing up for their communities, and their communities are standing up for them.
So what kind of action is being taken at the moment, just in terms of responding to the situation?
Well, we can only do the things we can do as in effect a public sector body. So litigation of our own is not an option. So for us, it's about applying pressure through the media, about political pressure through the political system. That's kind of amplified by our patient group, which is known as Slaithwaite, spelled Slawit. And now I'm in real trouble because I'm from East London, and you're only allowed to call Slaithwaite Slaithwaite if you were born and bred here. I wish I had been born and bred here, but for me I wasn't. So the patients are allowed to call themselves Slaithwaite Health Centre SOS, and they have their own Facebook page, and they everything they get up to is featured on the Facebook page, yeah, I guess in summary, what they're trying to do is to stand up for their community, for their own health needs, for the services that they value locally, and also stand up to what is a sense of injustice in the way that this has been and is being done, because it continues to unfold nationally. This affects 40% of surgeries nationally. It's over 2,000 GP surgeries in their communities are affected by this. And amazingly, it's had very little media interest. I mean, I think we have had some media coverage, but it's been a struggle. There's no national newspaper coverage of this issue. I think interest is emerging.
So you've been you were saying earlier you've been in contact with some of the other practices in similar situations. Just tell us about what their experiences are, what kind of groups you form, what kind of links you have.
Okay, well, we kind of broke our story in a kind of big way on Radio 5 Live and in the Financial Times online. I can't say there was a particular logic for that, but that's just kind of how it happened. But in response to that, we got contacts from other surgeries. I even had a friend from medical school rang me up and said, "Paul, I just heard you on the radio," which is really quite nice, really, when you haven't had to go around emailing everybody or what have you. So people did get, GPs across the country heard some of that, or their patients heard some of that. And they started to contact us. So what we did was set up a website called Family Doctor SOS and .co.uk, and there is a Twitter feed and a Facebook site that sort of complement that to try and deal with that level of interest. Partly, I think there was a fear that we might get swamped as a small practice with contacts. That's not been the reality. I think it's been a steady trickle of contacts, and I think when they hear our story. And they hear the story of the Jubilee Street practice in Tower Hamlets, which was relating to the other type of contract, GMS, and the MPIG cuts that they stood up to. And they also hear about the Page Hall story in Sheffield. Their conclusion is, for the ones who want to do something about this, it's a very straightforward message. Talk to your patients, because nobody else has done so. And when they do that, it kind of triggers an avalanche of support and practical help from local people. I mean, the folk that have come forward here the skill sets, the talent that they bring to the table is quite remarkable. The NHS now has surgeries in, most of the regions who are doing something, have gone public in some way, and are taking various types of action with their communities and patients. The interesting bit for me is London, because I'm from East London originally, and by a strange coincidence, the only surgery that's on our campaign map is in East London, and it's from where I come from. It's from Leytonstone. That's nothing to do with me. They came to us, and I don't really know what they're up to. I must get in touch and find out. But out of those, it must be thousands of surgeries. How many surgeries? Well, there are 8,000 surgeries nationally. Well, there must be thousands of surgeries in London, or certainly over 1,000 or what have you. We must look up how many surgeries there are in London. There are hundreds who are affected by enforced PMS contract cuts. I don't understand why there aren't more on the map, and I don't understand why they've not been in touch. Genuinely, I think part of it is that the contract reviews have been kind of phased in, and I get the feeling they've left, for whatever reason, they've left London to last. I might be wrong about that, but certainly it's happening only now in London. Are they beginning to have the contract enforcement meetings, which is what they are. So I hope some London practice managers and GPs get to see your coverage, and I hope they get in touch, because at the end it's up to them what they do, but certainly this little national network of surgeries that have been through this over the last few months, I'm sure that we and others would be happy to share our experience and some of the resources that we've built in terms of communications, etc., and networks. I think one of the sort of positive aspects for us is that this has been a really heavy burden for us. It's tough being in charge of anything, but it's tough to be in charge in desperate times. To walk in here in the morning knowing that you've just had another letter from NHS England about a 44% budget cut that you're not allowed to tell anybody about, to smile and pretend everything's all right. But by going public, it took the pressure away. It also galvanised the staff. I think that's really interesting that they, obviously we hadn't told the staff because we were told not to tell anybody, but it became clear that we were going to have to start planning redundancies and closure of services. So we started to think, what would that mean? And for us, the surgery would be closed in a year or 18 months anyway. But we were determined to fight on and try to carry on providing a service as long as we could. But the effect it had on the staff is it's kind of galvanised them, I think. Hopefully you can get to speak to some of our colleagues here. There's a sort of element to the kind of Dunkirk spirit, I think, that we're all in this together, we're all looking after each other, and we've got 5,000 patients looking out for us, asking after us, bringing in presents, offering practical help. Yeah. So I don't regret for a minute that we went public, and I'm sure the other surgeries nationally who've done it so far would probably say the same, and hopefully some more will come forward.
So if the worst was to happen and you had to close, where would the patients go?
Well, I think it's a really good question. This is a small rural village, and there are two surgeries here. Slaithwaite Health Centre, where we are today, and then there are friends at Colne Valley Doctors that have two sites, just the other side of the village, and they have a site, a surgery in Marsden. And they're the other end of the spectrum, so I don't work there, but they're not as well funded as we are. I think they must be on a GMS contract. I don't know for sure. I think they are. And there's a discrepancy there, which is not fair. and they must be working under a lot of pressure. We all are. The whole of general practice is in crisis. People talk about there's an emerging crisis in general practice. Well, actually, we've been in crisis probably for a year or 18 months. We're now at the tipping point where surgeries are falling over, and our friends and colleagues at the neighbouring surgery have two of their doctors have just left. So that question about where will people get services, I don't know. I think the commissioners would say that they'll re-tender the service, but re-tender the service at what contract value and what level of investment per patient, I think, is the big question. And the answer is that something like £80 per patient per year, which is nearly half what's being paid here. So that means half as many doctors, half as many nurses, which means half as much service. And no one's told the public about this.
At the moment that we understand, there's Slaithwaite Health Centre that's under review. The University of Huddersfield Health Centre is also under a similar kind of review. And there's a proposal from the CCG to close Huddersfield A&E as well. What do you think the impact of all those three together could be?
Well, slightly worse than that, because it's Huddersfield has got nearly 60% of the practices are PMS practices. So there are 38 practices in Huddersfield, 22 are facing cuts.
It's about 56%.
56, just under 60%,
right.
Yeah, 57% I think,
Okay.
but we'll see. So the impact of that, my disclaimer is I haven't seen the consultation document, but I haven't seen the consultation document, and I will reserve judgment until I have. But what my patients will demand, and I think increasingly what local health professionals will demand, is that these are plans for services for local people, that they're not just cost-based plans. I think that's the key issue. I don't know because I haven't seen the consultation document yet. I think most doctors working on the, I can't talk for most doctors, so I don't represent any of them, but I certainly get the case for change, but that's a national case for change. The version 1 of the NHS and what's left of social care has kind of come to its end. It's unravelling, it's unravelled, it's in a deep state of distress. And I think the public now understand that, or increasingly understand that, because they're seeing the impact on the services that they receive at a community level and at a hospital, and they've seen the erosion of social care and mental health services, yada yada yada. So I think the question about Huddersfield A&E, as people term it, and the question about Slaithwaite Health Centre and the university health practice and the other practices in Huddersfield affected by cuts, is actually a symptom of a greater kind of malaise around a lack of political honesty, really, and I blame all the parties for that. There is a lack of honesty about just how desperate things are. There's been a failure to anticipate what was entirely predictable, that the health service in its current form would not sustain the relentless increase in escalation in needs and costs that were inevitable with population changes and an ageing population, etc. So for me, the future of that debate about Huddersfield A&E, and indeed about the funding here, is part of a much bigger debate about taxation levels, about the scope and purpose of the NHS going forward, about the scope and purpose of tax-funded social care. And for me, until we have that debate as a country, I don't think anyone can solve the funding issues here, or the future of Huddersfield Royal Infirmary and its A&E department and the university practice. For me, the only hope is that the politicians can find some way of coming together. I'm a GP, not a politician, but you just have to get around the table and work in some sort of cross-party fashion and calls for some kind of independent inquiry into the future and talk to the public. You know, that's why we're allied to an organisation called NHS Survival. So in summary, I think the plight of the health and social care system in Huddersfield is a symptom of a much bigger national malaise and crisis in health and social care. And until we have that big debate as a country, I think we will just see more and more stories of community services being eroded, of a loss of local services. But ultimately, I don't think the public will stand for that or reach a point where, you know, the NHS is much cherished by people. I mean, somebody once described it as almost having the status of a national religion. We all feel so passionate about it, and rightly so, because there's nothing like it in the rest of the world. So there is going to be a debate, I think, and for the politicians, they really ought to get on and have it now, really. We don't need to be dancing around the table. We don't need to see the best of our local services closed and lost with all the talent that works in them, because I think when you've been part of something that's successful and it comes to an end, it's very difficult to pick yourself up and regain that drive and build something else again. I think that would be my comment on the situation we're in here in Huddersfield.